Hello, my dear future nursing officers. Welcome you all to the Master Nursing classes. In the previous class, we have discussed lots of the important thing. So in every question, we have discussed those golden points and the rapid revision of those very important high yield content for your upcoming exam. So in this today's class also, my thing is very clear that to give the very high yield content and the very important content for your upcoming exam. So it is up to you people whether you will utilize it or not, right? So I hope everyone enjoyed the yesterday's class. Okay, so the today's class also will be with the same energy and the same motivational thing, and the thing which will help us to boost our energy and to boost our particular strength to give the best shot in the exam, right? So yes, without wasting the time, we will start the today's session. And a very good evening to one and all. Very good evening to one and all. Is that voice video? Is that everything is clear? So what do mention in the comment box. Is that voice video everything is clear? Yes, what do thumbs up in the comment box, guys. Well done. Okay, yes. So very good evening to one and all who are attending the live session. So hit the like button, and if anyone of you are new to the Master Nursing classes, so subscribe to the channel also and hit the bell button, so our next classes and next updates which we are uploading on the Master Nursing classes educational YouTube channel, so it will be get notified to you all, right? So a very good evening beta, good evening. So share the link with your friends and if possible share the link in your WhatsApp status. We will start the session now, okay, without wasting the time, with this powerful and a very disciplined motivational line. Students, either one thing happens in the life, whether the growth happens or whether we will be in the comfort zone. The both comfort zone and the growth will be not coexist. Yes, if you are in a comfort zone, the growth will not possible. If you are in a growing phase, the comfort is not possible, right? So you have to understand the basic truth of the life, so that whenever we will be out of the comfort zone, then only we will be experience some real growth, right? So well done, a very good evening to one and all, and thank you for the huge support what you people are showing on the Master Nursing classes, which is actually boost our knowledge and which is actually boost our confidence, which is actually boost our strength to give the maximum efforts towards you people, right? So all of thing at the end, just we required one share and one like and one subscription. Yes, okay. So every one of you do hit the like button. We will start the session now. Yes, almost all people have joined to the session. So yes, I will start the session now, students. So please do remember the tagline that growth and comfort never coexist together. Either if you want a growth means come out of the comfort zone, and if you want comfort means forget about the growth. Okay, yes, let's begin the session. Here comes the first question, and a very important question in front of you. Yes, what is the recommended daily dose of the vitamin D supplementation for the healthy newborn? Healthy term newborn vitamin D supplementation dose is asking the question. Yes, what is the recommended daily dose of the vitamin D supplementation for the healthy newborn? That is the term newborn. Yes, comes to the vitamin D is very essential. We need to give to the newborn. Okay, especially vitamin D3 we will give. Okay, so that is the syrup form. Okay, so that will be in the syrup form. Okay, so this syrup form of the vitamin D, okay, that we need to give to the newborn child. Okay, what is the dose of the vitamin D? Yes, do mention the answer in the comment box. Well done. Okay, so we will give the 1 ml of the vitamin D syrup. Is that it is there in the option? No, it is not there in the option. Sir, 1 ml contains how much international units, sir? Yes, it contains the 400 international unit of the vitamin D3 syrup we will give. Okay, so that is the 1 ml of the vitamin D3 syrup we need to give, and so that is the 1 ml is equal to 400 international unit. The standard dose will be there. Okay, so this will be asked in your exam, so please do remember, right? Yes, along with this 400, remember one more 400 tablet albendazole for the destroying the helminths from the GI tract. Okay, in more than 2-year child we will give 400 mg, not IV, that is the 400 mg. Okay, so please do remember, again very important, 400. Okay, so 400 are very important for the exam, so please do remember, right? Here comes to the next question. So do read the question carefully, completely, properly, perfectly, then give the correct answer in the comment box. Yes, the question you people will experience somewhat lengthy, but these are the important question, right? So the question, in the question what they are asking, a 24-year-old male, a 25-year-old male is brought to the emergency department after the motorcycle accident. What happened to a 24-year-old male? The motorcycle accident happened here, okay? And he is pale, means his body is discolored to the pale color, and he is diaphoretic, means he is getting sweating excessively, and he is confused, right? Pale body is there, excessive diaphoresis means excessive sweating is there, and the confusion is there, okay? And his blood pressure is 80 by 50 mm of Hg. These kind of the scenario based questions will be struck in your exam, so please do remember, okay? So blood pressure will be 80 by 50 mm of Hg, and heart rate will be 132 beats per minute. What happened here? Here the hypotension happened. Along with the hypotension, the tachycardia is happening, right? So hypotension and tachycardia is happening, and the respiratory rate is 26 per minute, okay? So that is the, along with this, tachypnea also will be there, okay? And his abdomen is distended, and the bruising is there over the left flank area. And what is the most likely type of the shock is this one, beta. The bruising is there, bruising is there in the left flank area, okay? Means there is an the intraperitoneal bleeding is there, so that is the reason abdomen also distended here, right? Along with this, the bleeding is there, so volume in the vasculature, so that is in the blood vessel volume is depleted, means the blood vessel in volume in the blood vessel is decreased, so that is the reason there is a hypotension is there, right? So the blood pressure is decreased, so in order to compensate, our heart rate will increase, okay? So hypotension, tachycardia, okay? So evidence of the bleeding, it will be there, means this is a classical scenario for the which shock. Yes, almost all you people given the correct answer. That is the case of the hypovolemic shock. Okay, this is the case of the hypovolemic shock. What happens in the hypovolemic shock? So there will be a severe deficiency of the volume. Okay, so there is a severe deficiency of the fluid volume. Very important. So please do remember, fluid volume is severely deficient. So we call that may leads to the like inappropriate or the reduced perfusion to the vital organs. Vital organs are not getting the sufficient circulation, means perfusion, means that is what we call as in the shock. Okay, so that is what we call as in the shock, right? So this hypovolemic shock, which happens due to the decreased fluid volume. So this decreased fluid volume happens due to the excessive vomiting, excessive diarrhea, and any motorcycle accident or the any road traffic accident with heavy bleeding. Okay, so any road traffic accident with bleeding, right? So very important. Along with this, yes, in a diabetic ketoacidosis, yes, in a case of the diabetic ketoacidosis and untreated diabetes mellitus or the complicated diabetes mellitus, yes. So these are the important situations where the fluid will be excessively lost out of the body. Okay, so fluid will be excessively depleted out of the body, so the vital organs are not getting sufficient blood supply. That is what you call as the hypovolemic shock. The treatment of the hypovolemic shock will be the replacement of the fluid. Okay, so the replacement of this fluid. So which fluid we will give? We will give the isotonic normal saline. Okay, that is the 0.9% isotonic normal saline is the treatment of the choice. Okay, so IV bolus we will push. Okay, so that is the very important. Please do remember regarding the hypovolemic shock. Here comes to the next three types of the shock. Remember there are the hypovolemic shock, cardiogenic shock, and a distributive shock. In the distributive shocks, again three types will come. Okay, so totally mainly classically we will divide the shock into three portions. One is the hypovolemic shock. There is the fluid is decreased due to the bleeding, due to the hemorrhage, due to the vomiting, due to the diarrhea, due to the excessive polyuria in the diabetic ketoacidosis and in the complicated diabetes mellitus. The fluid is decreased, means that is what you call as in the hypovolemic shock. Hypo means decreased, volemic volume. Okay, which volume? Fluid volume. So hypovolemic shock, right? So along with that, the very important one more we have, that is the cardiac shock. In the cardiogenic shock, what happens? The fluid is there normally, but heart is not pumping properly. The heart is not pumping properly means the blood is not going out of the heart. So blood is not going out of the heart means the blood is not going till the vital organs. The blood is not going till vital organs means what happens? Blood is not going till the vital organs means there is in the hypoperfusion of the vital organs. So there is in the deficiency of the nutritive supply, deficiency of the oxygen supply. So that may leads to the experience of the shock. Okay, so that is what we call the cardiogenic shock. Normal heart, low fluid, hypovolemic shock. normal fluid, no heart or the low cardiac function, that's the cardiogenic shock, right? So along with that we have the a distributive shock type. Okay, so remember the mnemonic, the assistant nursing superintendent. Okay, so after clearing the prelims exam you will clear the mains exam, and after working the 78 years in the reputed AIMS institutes, so you will be getting promoted as in the SNO. After that you will be getting promotion as in the ANS. Okay, that is the assistant nursing superintendent. To please do remember the distributive shock types. Okay, so assistant means here is the anaphylactic shock. Okay, so then the assistant is the anaphylactic shock A, that is the nursing is the neurogenic shock, and the septic is the yes superintendent. Okay, so please do remember the ANS or autonomic nervous system also you can remember, or the very important, that is the assistant nursing superintendent also you can remember. Okay, so that is the anaphylactic shock, septic shock, and neurogenic shock. What happens in the distributive shock, sir? What is the problem? Better in the distributive shock, heart is also normal and fluid is also normal, but the blood vessels it will be constricted like this. Okay, in the periphery the blood vessel should be constricted like this normally. Okay, but in the distributed shock what happens, the peripheral blood vessels will get dilate like this. Okay, so it will get dilates like this, and all the volume, all the blood or all the volume inside the particular blood vessels, it will get pooled in the periphery only. Okay, so this particular fluid it is getting distributed in the periphery only, which is not coming to the heart. Which is not coming to the heart means the heart is getting the low returns. Low cardiac returns means it is unable to fill properly. Unable to fill properly means unable to pump properly. Unable to pump properly means, so it will be a very important, less blood supply will go against the vital organs. Okay, so that is what you call is in the concept of the distributive shock. Okay, in the concept of the distributive shock what happens, all the volume it will get pools in the periphery due to the important peripheral vasodilation. Okay, so that is the in the all septic shock, anaphylactic shock, neurogenic shock. Okay, so the blood will get pooled in the periphery, but the cause is different. Okay, in the septic shock the blood is pooling in the periphery due to the systemic response to the dangerous infections. Okay, so there is a dangerous infection, okay, which will release us the bacterial toxins. Okay, so mainly infections which is occurring due to the bacteria, okay, which will causes the septic shock most abundantly and most commonly. Okay, so this bacteria which will release us the bacterial toxins, so that toxins which makes the blood vessel to get dilate, and all the blood which is pooling in the periphery only and which is not coming to the heart, which is not coming to the heart means heart is unable to supply the blood till the vital organs. Okay, yes, this is the called as the septic shock. Okay, and the anaphylactic shock, understand the concept in the anaphylactic shock. Whenever the patient is getting exposed to the sting bites, okay, sting bites or the insect bites, okay, so the otherwise he had some allergic food like peanuts, okay, and he had some allergic reactions. Okay, so due to allergic reactions or due to the IgE mediated or due to the very important leukotrienes mediated or the inflammatory mediators, so there is in the a severe dangerous khatarnak allergy will be there. So that allergic reactions, again the blood vessels will get dilates. Okay, the blood vessel in the periphery will get dilate, and the blood will be pooled in the peripheral blood vessel only. Okay, so very important, please do remember that is the anaphylactic shock happens due to the allergic reactions, right? So next comes to the neurogenic shock, which happens due to the spinal cord injury. Okay, so usually above the T6 level if it is happening is, so that is what we call it in the like spinal cord neurogenic shock, which is dangerous. Okay, so then the traumatic brain injury or the spinal anesthesia which may lead to the neurogenic shock. So please do remember assistant nursing superintendent or the autonomic nervous system, ANS, anaphylactic shock, neurogenic shock, and the septic shock. Okay, so these are the three types of the distributive shocks. Okay, very important, please do remember. Here comes to the question. Okay, scenario based questions. What are the clues we need to grasp, and what are the clues we need to hold in the mind, and how we need to choose the answer immediately after reading the question, and how we need to understand the concept of the every shock, because the shock is very important for you all, and shock will be such a very important concept. So it may give you a shock in the exam. Okay, why? Because there is a chance of the 3 to 4 questions coming out of the shocks in only one exam, right? So that is the reason. So don't you people get land into the shock. Okay, so please do read the shock to avoid the shock. Yes, is that clear? Yes. So the question is here, a 40-year-old man sustained a cervical spine injury. So what happened to a 40-year-old man? So 40-year-old man, he exposed to the cervical spine injury. Okay, so in a car accident, right? So he is hypotensive, right? There is in the decreased blood pressure will be there. So that is the 80 by 40 mm per G blood pressure will be there. And bradycardia, better only one shock which will be having the effect of the bradycardia. So which shock is that one? Yes, BP also decreasing, and along with the blood pressure, there is in the heart rate also decreasing. So which shock is this? Yes, hypotension and bradycardia will be seen in which shock? Yes. So let me complete the question. Okay. So the patient is having the hypotension and bradycardia with a heart rate of the 50 beats per minute, right? His skin is warm. Okay, his skin is warm. One more clue to choose the correct answer. And his skin is dry. Okay, and there is no any sign of the external bleeding. So no sign of the external bleeding means, so this is not in the hypovolemic shock. Or in the hypovolemic shock, what happens? BP is decreasing, but in order to compensate the reduced volume, the heart will work more and there will be a tachycardia, right? So hypotension, tachycardia will be the earliest sign of the fluid volume deficit. Note down, very important point. Early sign of hypovolemia is that is increased heart rate. So please do remember. Okay, but in the question there is a bradycardia is there, means it is not in the hypovolemic shock. I'm eliminating the option B. Okay, so next comes to the cardiogenic shock. Better in the cardiogenic shock, okay, so there is on the volume is normal, the patient will not land into hypotension immediately. Okay, so there will be a congestion of the fluid will be there in the periphery, so it may lead to the abnormal false high BP we may experience. But here it is telling the bradycardia. Again in the cardiogenic shock, yes, there will be lots of the evidences will be there, and the patient is having the most common reason of the cardiogenic shock is the myocardial infarction. Okay, chest pain and all. So that kind of the symptoms the patient will experience here. Okay, hypotension, bradycardia not indicates the cardiogenic shock. I am eliminating the option A as well here. Okay, so next comes to the neurogenic shock. But in the neurogenic shock only the classically we will see the bradycardia. Brady means decreased, cardia means heart rate. Okay, cardiac function is decreased or the cardiac heart rate is decreased. There is the brady means decreased cardia. Okay, so there is a decreased heart rate will be there, and bradycardia, hypotension also will be there. Okay, hypotension and bradycardia is experiencing only in a neurogenic shock. This is the important beta. It will be your examiner favorite question. So the question may repeatedly comes in your exam. Okay, yes sir, in case of same scenario I am given to you people, I will twist the question. So tell me the answer. 40-year-old man sustained the injury at the T4 level due to the car accident. Now he is having the hypertension and bradycardia. There is increased blood pressure and the decreased heart rate. Which situation is that? And his upper body is full pink, and goosebumps are there. Excessive sweating is there. Face is completely flushed and looking like a monkey. Okay, so along with that, okay, there is patient is having the khatarnak highest hypertension. The blood pressure will be excessively increased, and the patient is having the throbbing headache, right, which is above the level of the injury. And in the below the level of the injury, patient is pale. He is not pink, pale, and the low blood pressure. Okay, and there is no any sweating and there is no any goosebumps in the below the level of injury. Okay, so hypertension and bradycardia in a spinal cord injury, which indicates very nice all of you. I really love your answers. I really appreciate your talents. But this is the very important thing, how we need to clinically interpret the thing. Yes, you all are excellent, so that is the reason result will be ours. Don't think much. Okay, result will be ours this time, because we have reached all the important point and we have reached all the important area of the examiner's favorite. Okay, so that's yes, autonomic dysreflexia. We will solve the question on the autonomic dysreflexia, and in that one I will explain some nursing intervention to you people. So please do remember, because in the last previous Norcet there was a question. Okay, so which one we will experience in the autonomic dysreflexia? In the options there was the hypertension and the bradycardia got the correct answer. Okay, this time there is chance of asking the question from the nursing intervention, because it is completely in our hand to avoid the autonomic dysreflexia. Yes, we are having the capacity and ability to avoid the autonomic dysreflexia by simple education and by simple intervention. Okay, so that one I will educate, I will teach to you people in this particular class only. Okay, yes, so this is a classical case of the neurogenic shock. Okay, this is the classical case of the neurogenic shock. Hope it is clear to every one of you. Yes, very good, right? So this is what, as my students, I want every one of you to, yes, to get participants best. Okay, yes. And please do remember the two more very important things here. Okay, if the patient is getting the injury at the cervical spine level, okay, so always if he is getting the injury at the C4, please do remember from the cervical 4 there is in the one very important nerve will originate. Okay, so the nerve is the, yes, which nerve is that one? Yes, that is the phrenic nerve. Okay, so that is the phrenic nerve. So this nerve which will supply the diaphragm, the very important muscle of the respiration. Okay, it will get the supply to the very important respiratory muscle. So that is, it will supply to the diaphragm muscle. Okay, so if he is getting the injury, means the person is getting the injury at the C4 level, so phrenic nerve is getting damaged, means the diaphragmatic palsy may happens. Okay, and the patient may get land into the respiratory arrest. Okay, so that is the reason whenever there is in the injury at the C4 or the especially cervical level, always the first priority is to maintain the respiration. Okay, so please do keep in your mind. Okay, because from the C4 only our phrenic nerve will originate, and this phrenic nerve is the nerve which is having the a very important function of the diaphragmatic contraction, which is very much necessary for the respiration. Okay, so please do remember the concept. Okay, hope it is clear to every one of you, right? So here comes to the next question. Yes, a 55-year-old man presents with high grade fever. So what happened to the 55-year-old man? For him, high grade fever happened, and the patient is hypotensive, that is the SBP is 80/50, and the patient is tachycardic. Yes, the patient is having the hypotension and tachycardia. On exam, his skin is warm. Beta, listen. 55-year-old man is there, and he is having the high grade fever. Patient is having the hypotension, tachycardia. On examination, his skin is warm and flushed. Okay, and lab test reveals elevated WBC count. Which type of the shock is this? Yes, which type of the shock is this person is experiencing? Option A, cardiogenic shock. Option B, anaphylactic shock. Option C, septic shock. And option D, hypovolemic shock. Yes, we have seen in the hypovolemic shock there will be a heart rate, it will increase, that is the tachycardia, and their BP will decrease, that is the hypotension. But there is in the fluid volume deficit, the person body will be cool and calm. Okay, so person periphery will be cool and calm, and BP is decreasing, heart rate is increasing. So that is our hypovolemic shock. That is our hypovolemic shock. But in the given question, what happened? So there is in the hypotension is there, BP is decreased, and the heart rate is increased, but the body is warm. Yes, the warm body, just now we have studied in the neurogenic shock. But in the neurogenic shock, what happened? The heart rate also decreasing. Here the heart rate is increasing, right? So this is how we need to like differentiate between the each type of the shock. So BP is decreasing, heart rate is increasing, and the warm means, so this is a case of the septic shock. This is a case of the septic shock. Very important. Please do remember. Heart rate is increasing, BP is decreasing, and the body is cool and calm. So hypovolemic shock. BP decreasing, heart rate increasing, and the body is warm. That is the septic shock. Along with this one, BP decreasing, and heart rate is also decreasing, and body is warm. So this is the very important a case of the neurogenic shock. Okay, so this is a case of the neurogenic shock. Please do remember the concept, because this is the important for you all, right? Hope it is clear to every one of you. Yes, so here comes to the next question, and this question answer goes to the septic shock. Why? Because the WBC also increased, means the patient is having the severe bacterial infection, and there is the lactate is also increased, means there is in the lactate increased, means it is the indication of the anaerobic respiration of the cells. Okay, why? Because so this blood vessel which is supplying the proper oxygen to this particular cell means so it will undergo into the aerobic respiration. Okay, so whenever there is in the shock, so less blood supply means so here less oxygen supply, so without oxygen the metabolism is happening means so that is what you call the anaerobic metabolism. Okay, anaerobic metabolism, in that particular case the lactate will increases. Okay, in that particular case lactate will increases, so please do remember. Okay, so there is an increased lactic acid or the lactate, which indicates the a person is having the hypoperfusion. Okay, and the WBC is increased means the person is having the shock means due to the person is having the infection. So due to the infection the shock is happening, which indicates what? Which indicates the yes a septic shock. Hope it is clear to every one of you. Yes, here comes to the next question. So please do read the question carefully, completely, and try to give the best answer in the comment box. Yes. A 25-year-old woman suddenly develops a shortness of the breath, generalized itching. What happened to a 24-year-old woman? She is suddenly getting shortness of the breath. Then along with that, she is having the generalized itching, full body she is itching. Okay, along with that, a swelling of the lip. So lip is completely swollen and the patient is hypotensive. Yes, the blood pressure also decreased. So and she has the history of the eating the peanuts. क्यों खाना है भाई? छोड़ना है. Okay, क्यों खाना है peanuts? So she had the peanuts. Okay, so yes, after the having the peanuts, she getting the low blood pressure, swelling of the lips, generalized itching, and shortness of the breath. So on examination, she has the wheezing. She is having the wheezing that indicates the airway is getting inflamed here. Okay, and the urticaria. Urticaria means yes, like a rashes will becomes with a very intense itching feeling. Okay, so full body there will be a rashes will be there. Okay, so suddenly rashes will develop. Immediately rashes will develop. Okay, so there is the red in color and the rashes will be having the very intense itching feeling. Okay, that is what you call the urticaria. Okay, and what is the most likely diagnosis of this particular case? Yes, guys, fatafat do mention your answer in the comment box. It's very easy again. Yes, that's the case of the anaphylactic shock. This is the case of the anaphylactic shock. So what happened here? She had the peanut and she is having the allergy to the peanut. Suddenly she is getting the generalized itching. So that indicating that there is the allergic reaction. Okay, so that allergy what happened, which increased the inflammatory reactions in the respiration, so respiratory tract. So the patient is having the shortness of the breath and the wheezing also there in the patient due to the severe allergic reactions which causes the constriction of the airway. Okay, so due to the allergic reactions the swelling of the lips also will be there and the hypotension which indicates the peripherally blood vessels is vasodilated. Okay, and in the periphery only the entire blood which is not going back to the heart and the entire blood is pooling in the periphery only. So the peripheral pooling of the blood means the less cardiac return means yes, there is then the risk of the shock will be there. Okay, so that is the reason all the symptoms which is showing here, which is the indication of the allergic reaction. So the patient is in a state of the anaphylactic shock. So please do remember this particular very important lines. Okay, so hope it is clear to every one of you. Yes, the urticaria, wheezing, itching, swelling, and hypotension. Okay, after having the peanut. Okay, so the patient is having the peanuts. Okay, so that is the reason while explaining the anaphylactic shock in the assistant nursing superintendent, I told that is anaphylactic shock happens due to the some food allergy and some insect bite or the sting bites. Okay, and after taking some drugs. Okay, and these are the usual triggers. Okay, so that happens due to the severe allergic reactions. Okay, which is IgE mediated. Okay, which is IgE mediated. Okay, which immunoglobulin will increases in the allergic reaction? Yes, 1000 times asked question. That's the immunoglobulin E. So hope the concept is clear on the each type of the shock. Okay, here is the next very important question in front of you all. Yes, in the first question only I told the answer of this question. Yes, how many of you are remembering? I want to know. So fatafat do mention your answer in the comment box. Right? I want everybody's answer in the comment box. Yes. Fatafat. Which of the following drug is commonly administered during the National Deworming Day? Beta, we will celebrate your birthday. That is National Deworming Day. Is this your birthday? No, beta. This is the death day of the all the elements which is there in the GI system of the growing children's. So the elements which are staying in the GI system of the growing children's, whatever the child will have the food, it will, the elements only it will eat and it will finish. So the child is having the food and it is used by the elements. Okay, so the child growth and development will be stunted. Okay, the growth and development will not happens properly, and the child will repeatedly experience the GI symptoms like abdominal pain, vomiting, and especially the diarrhea. Okay, in order to celebrate the death day of the all the elements which is there in the GI system of the growing children, 2 times in every year, that is what we call as the biannual program. Okay, so bi means 2, annual means year. Okay, so yearly 2 times a biannual program we are celebrating to destroy the all the elements or the worms which are there in the intestine of the growing children. Okay, so to terminate all the elements, okay, we will give the tablet that's called as the albendazole. Okay, so this albendazole will be administered by the oral route, by the oral route, to whom we will administer to all the growing children. Okay, so that is the Anganwadi and the school going children we will give. Okay, so in this one it depends on the age of the child, the dose will be different. Okay, if it is child is less than 2 year of the age, okay, the child is less than 2 year, so we will give them only 200 mg of the albendazole. So that is in the syrup form. Okay, that is in the syrup form. Very important, keep in your mind. Okay, if the child age is more than 2 years, okay, so we will give the albendazole tablets, so that is the 400 mg. Okay, so this will be in the tablet form, this will be in the tablet form. Beta, we are giving a syrup to the child, means it will distribute properly in the GI system. So we are giving the tablet, means it will go directly into the stomach, and through the stomach it will get digest, and it will get eliminates from the body. So in order to avoid the immediate elimination from the body, so we will ask a child to crush the tablet in the mouth and swallow. Okay, so not to directly swallow the tablets. Yes, the child need to crush the tablet in the mouth, then the child need to swallow. Okay, so that is the very important nursing education we need to give. Okay, so please do remember the dosing. Okay, so when we will celebrate the National Deworming Day, the examiner's favorite question. Okay, so in your last Norcet, the question was there in the prelims also, question was there in the mains also, and in the rapid revision sessions. So I have covered the concept, it have strike in the exam. Okay, yes, so 10th, okay, so 10th of the February and 10th of the August. So I told it is in the 2 times in a year, so that is what we call this one is in the biannual program. Okay, what we call this one is in the biannual program. Very important, please keep in your mind the biannual program. Okay, so that is 10th February and the 10th of the August we will celebrate the National Deworming Day. And remember the dose what I have told to you people, less than 2 year 200 mg and more than 2 year 400 mg. So this is the tablet form, ask the child to crush and swallow. This is the syrup form, give it directly. Okay, so very important, I hope it is clear to every one of you, right? So here comes to the next question. Yes, the scenario which I was created in front of you all while explaining the neurogenic shock. Yes, the same scenario is there. So here in this particular thing, you have to identify just the situation, and I will tell what to remember and how to approach in the exams. Okay, so the question is here. Yes, a 28-year-old male with a T4 spinal cord injury. Okay, so what happens? 28-year-old male is there, and he is having the injury at the level of the T4 means which is above the T6 level. Okay, so that is the very important. And so there is in the sudden onset of the severe hypertension is there. Okay, so what is that? It is there is in the severe hypertension will be there. Okay, in the hypertension, the most common symptom the patient will say in the hypertension is the headache. Here the patient is having the severe hypertension, means the child will the person will be having the throbbing headache. Okay, the person will be having the throbbing headache, and along with the hypertension there is in the bradycardia is there. Heart rate is decreasing and the blood pressure is increased. Okay, so that is the along with the hypertension, bradycardia is there. Along with that, there profound headache is there. Khatarnak headache will be there, and a sweating above the lesion level. Okay, so above the level of the injury, there will be excessive diaphoresis or the excessive sweating will be there. Okay, so along with that, there will be a goosebumps also will be there. Okay, so please do remember what is the most likely diagnosis. Yes, almost all you people given the correct answer, that is the autonomic dysreflexia. This is the case of the autonomic dysreflexia, or we can say autonomic hyperreflexia. Okay, in the autonomic hyperreflexia, what happens? There is in the hypertension plus bradycardia. Please do remember the very important points. So these are the examiner's hot favorite question. Okay, hypertension and bradycardia evidence will be given in the particular question. Along with that, there will be a profound headache will be there due to the severe hypertension, and a very important. Okay, why the hypertension is happening, why the bradycardia is happening is the your question, right? So let me explain to you people. Okay, this is the spinal cord. So this will be a spinal cord. So yes, here will be a T6 level. You please consider this one as the T6 level or the thoracic level number 6. Okay, if the injury is happening above the T6 level, okay, so anywhere in the T4, T5, T4, T3, T2, T1, anywhere, or in the cervical spine anywhere, okay, above the T6 level, if the injury is happening means, so there is highest chance of the autonomic dysreflexia. Okay, so why it happens and how it happens. So please do remember, I told the injuries happened at the T6 level and above. Okay, so injuries happened here. Consider now the patient's bowel or the bladder. So this is the bladder and here will be the bowel. Okay, so here will be the bowel. Okay, so in this particular bladder and bowel, okay, the bladder complete urine is filled, in the bowel complete feces is filled, or the distended bladder we can say, or the impacted bowel we can say. So this one, it will try to send the signals above to the brain, but here the spinal cord is damaged. Okay, so it will bypass and it will send the signals to the brain. Okay, so this brain, what happens, it will send the signal back to the our particular spinal cord through the particular organs, but here the spinal cord is damaged. So because of this, there is a abnormal reflexes will generate. Okay, or the dysreflexia will happens. Okay, so here because of this stimulations like a bladder full or the impacted bowel, or due to the any pressure or the pressure ulcer at the sacral area, okay, or the pressure ulcer below the T6 level, okay, so which will send the pain signals. Again the same situations happen. So that is the reason in the upper or the above the level of the T6, there will be a what we can say vasoconstrictions happens due to the what we can say due to the activation of the sympathetic nervous system. Okay, vasoconstrictions will happens. So this vasoconstriction dangerously, it will increase the blood pressure. Okay, so this increased blood pressure, what it will do, okay, so this increased blood pressure, so it will be creates the pressure on the baroreceptors. Okay, creates the pressure on the baro means a pressure sensitizing receptors. Okay, so this baroreceptor, okay, it will send the signals to the brain that so the BP is abnormally excessively increased, please reduce the BP. Okay, so now this baroreceptor sends the signals to the brain, and from the brain the signal is coming to reduce the particular heart rate. Okay, so that is the reason. Okay, so now the brain will send the signals to the heart, that is the to reduce the rate. Okay, so now because of this particular phenomena, now the heart rate is decreasing. Okay, now the heart rate is decreasing. So that is the reason in a person with the autonomic dysreflexia or the above the level of the T6 injury, we are getting the hypertension and the bradycardia. Hope it is clear to every one of you. Yes, send some love in the comment box. Is that clear? Hypertension and bradycardia will be seen in the autonomic dysreflexia. Why it is happening? It is happening to the full bladder, it is happening due to the full bowel, or it happening due to the small lesions or the small sacral or the pressure ulcers which is sending the signals. Okay, so that is the reason whenever the patient, it will comes to us with a spinal cord injury at the T6 level and above, so always catheterize the bladder and never ever allow the bladder to get filled. Okay, keeps on emptying the bladder and always keeps on giving the enema and empty the bowel also. That is the very important thing. So don't allow the bowel to get accumulated the feces. Okay, and frequently, so try to change and assess the skin also. Okay, try to change the position if not contraindicated. Otherwise you can keep on assessing a pressure ulcers. Okay, not allow the patient to get land into the pressure ulcers. Okay, again because the pressure ulcers which sends the signals, and again there will be a mismatch between the upper half of the spinal cord and the lower half of the spinal cord, and due to that one the vasoconstrictions will happen. Okay, so blood pressure will increase. So that is the reason above the level of the injury. So due to the high blood pressure, the face will be flushed. The face will be completely red and it will be flushed face. Okay, and because of this one, because of the activation of the sympathetic nervous system, there will be a goosebumps. There will be a goosebumps. The hair will get straight on the skin. Okay, so along with that increased blood pressure means there will be a severe headache or the profound headache. Severe and profound headache will be there. Okay, so these are the very important: flaccid skin, severe profound headache, and the goosebumps, increased BP above the level of the injury. Okay, and the heart rate will be get decreased. Okay, so these are the very important signs and symptoms which indicating the patient is experiencing the very important autonomic dysreflexia. And below the level of injury, yes, here the signals are not coming because of the spinal cord is injured. So here the below the level of injury person will be pale color. Okay, and like hypotension will be there. Okay, so above the level of injury, which is the pink color body or the flushed body. Okay, and hypertension below the level of the injury, pale color body, and the hypotension will be there. So this particular concept, what we call as the autonomic dysreflexia, which happens in a situation of the spinal cord injury. So which will be the examiner's favorite question. And don't forget the hypertension and bradycardia, which will be seen in a case of the autonomic dysreflexia. Hope it is clear to every one of you. So this is the just brief I have given. Okay, so after the exams we will study in detail about the nervous system. There I will teach you people why the mismatching is happening and everything. Okay, just it is on the simple concept I have explained to you people to deliver the perfect knowledge which is required for your for your exam purpose. Okay, so if you know how we need to manage and everything, okay, so that one we will deal in detail and in perfect in the future classes. Okay, just try to remember the situation and how the examiner will create it in front of you all. Okay, yes, so the correct answer for the previous question gone the autonomic dysreflexia. So hope it is clear to every one of you all. Okay, so here will be the next question. Yes, here will be the next question. So please do read the question properly, perfectly, and try to give the best answer. Yes, which of the following is the most preferred abdominal incision in a standard Cesarean section? Yes, beta. Which of the following is the most preferred abdominal incision in the standard Cesarean section? Option A, midline vertical incision. Option B, papanosteal incision. Option C, a Kocher's incision. And option D, McBurney's incision. So where we will give the McBurney's incision? Yes, be active in the comment box now. This is our assignment question. Okay, McBurney's incision is given in which particular situation? Yes, in a McBurney's incision will be given in a case of the appendectomy. Okay, while removing the appendix, we will give the McBurney's incision. Yes, very good, beta. So where we will give the Kocher's incision? Yes, where we will give the Kocher's incision? Not we, the surgeon will give the Kocher's incision. Okay, so in which situation the Kocher's incision will be given? In a situation where, yes, very nice of you. Okay, in the case of the cholecystectomy, we will give the Kocher's incision. Very good. Okay, so in the Cesarean section, we will go for the two kinds of the Cesarean section. One is the classical Cesarean section and another one is the transverse Cesarean section. Okay, the classical Cesarean section we also call it the midline vertical Cesarean section. Yes. So which one is the preferred incision of the standard Cesarean section? Better. So please do understand. Here we have the uterus. Okay, in this uterus, in the pregnancy, it will get divided into the upper uterine segment and the lower uterine segment. Okay, so this lower uterine segment, it is made up of the isthmus. Okay, lower uterine segment is made up of the isthmus. Okay, isthmus is the part which will get dilates and it will get big in the particular during the pregnancy, so it will be the lower what we can say lower uterine segment. Okay, so this one is the upper uterine segment. Okay, so this lower uterine segment, it will get dilates only. Okay, it will not get contracts, it will get dilates only. And this particular upper uterine segment, it will get contracts. Okay, so if in case you consider, if I am giving a incision on this particular upper uterine segment, okay, so here this incision I call this one as the midline vertical incision or the classical Cesarean section. Okay, what I call this one as in the classical C section. Okay, very important. If I am giving the incision here like this horizontal incision on the lower uterine segment, so I call this one as in the lower segment Cesarean section, LSCS. Okay, so that's the lower segment Cesarean section. So I told beta this upper uterine segment is getting contraction and the lower uterine segment is only getting dilation. Okay, so in the next pregnancy, if uterus is getting contracting that time, so due to the contraction of the uterus, this particular suture line in the next pregnancy may get abnormally separates, or there is in the risk of the, or there is in the highest risk of the uterine rupture will be there. Okay, so there is the highest risk of the uterine rupture will be there. So that is the reason the upper segment Cesarean section, or we can say classical Cesarean section, or the midline vertical Cesarean section is not recommended. Okay, so the recommended Cesarean section is that is our lower segment Cesarean section, because it will only get dilates. In the next pregnancy, we can do the Cesarean section easily also, or we can do the normal vaginal delivery easily also, because there is in the least risk of the rupture of the uterus will be there in the lower segment Cesarean section. Okay, so that is the reason the incision we are giving here the horizontally, so that incision is called as the Pappensteinian incision. Okay, so that is what you call as the Pappensteinian incision. So that is the very important, so please do remember in your mind. Okay, so the position which we need to give during the Cesarean section also we need to keep in our mind. Okay, so that is the supine position we will give, supine position we will give, but this supine position, what it will do, it will cause us the very important condition called as in the supine hypotension syndrome. Okay, so due to the pressure of the big uterus, it will create the pressure on the inferior vena cava, so there is no cardiac return, so which may cause the supine hypotension syndrome. So in order to prevent this one, so we will go along with the supine position, we will elevate the right, like little we will shift to the left side. Okay, means in order to bend little towards the left side, we will give the pillow under right hip. Okay, so we will give the pillow under the right hip. So this is the preferred position we will give to the patient with a very important who is undergoing into the lower segment Cesarean section. So why we need to give this particular supine position with the pillow under right hip, or the pillow or the wedge under the right hip? So that is in order to prevent the supine hypotension syndrome. Okay, so we can prevent it. Okay, we can prevent it by giving the pillow under the right hip, so the baby mother will be little turned left side. Okay, so that we can easily do the Cesarean section also, and we can easily prevent the supine hypotension syndrome also. The position which we will give in a patient with like during the Cesarean section is the supine position with the pillow under the right hip is our golden point. So please do remember. Okay, so hope it is clear to everyone of you. Here comes to the next question, and the most important question. Yes, the most common fetal presentation which is associated with the cord prolapse is which presentation is that one? The most common fetal presentation associated with the cord prolapse is, better there are the three terms you have to understand in this particular question. Okay, so one is cord prolapse, another one is the occult cord presentation, another one is the cord presentation. Yes, so there is the little bit differences there among these three words. Okay, and just the nursing management also most important on this particular cord prolapse. Okay, so before going to that one, just mention the answer which one is the most common fetal presentation which is having the associated with the highest risk of the cord prolapse. Yes, that is the very important. Transverse lies having the highest risk of the cord prolapse. Okay, the first Best answer is the in the transverse line. So there is highest risk of the cord prolapse. How, sir? Yes, every one of you know that already we have discussed this concept in the manual section. Okay. So there are the manuals video available in the YouTube channel free of cost. Completely, perfectly, best explanation I have given on the all the OBC manuals which are important for your exams. Okay. So please do watch the video after this particular video. Okay. So this is the uterus. Okay. Inside the uterus, here will be the baby which is there in the transverse position. Okay, so the baby's umbilical cord will comes easily outside. Okay, there is the reason this particular transverse lies among the highest risk of the cord prolapse. Okay, so please do remember this is the first one, this is the first one, and the second one is the in the bridge presentation the chance is there. Okay, so very important, please do remember, right? So the correct answer for this one is the transverse line. Okay, so you told the three very important words. One is the occult prolapse, then the card presentation, and the card prolapse. So what is the difference between all these three, sir? Yes, so please do understand and look at this particular image. So then we will go for the explanation. Okay, so here will be the baby. Here will be the baby is there, and this is the baby head. Okay, so and this the color which is there here, this is the umbilical cord. Okay, so the baby head is here and umbilical cord is alongside, which is not below the head. Okay, so look at the image B. So here will be the baby head is there and the umbilical cord which is there, which is below the head is there, right? So but in the first image, which is alongside of the head, which is not below the head, so that is what we call the occult prolapse of the cord. Okay, just the umbilical cord of the baby is lying beside of the head, or which is lying parallel to the head, which is not below the presenting part. So that is what you call the occult prolapse or the hidden cord prolapse. We can say this one. Okay, so occult prolapse or the hidden cord prolapse, right? So in the B comes to the image B. So here this is the baby head. Okay, so below the baby head umbilical cord came, but the membrane is intact. And the umbilical cord not came out of the vagina. Okay, so which is still inside. So we call this one as the cord presentation. Means cord is just presenting in front of the presenting part. Okay, or the in front of the head. This is what we call the cord presentation. But what is cord prolapse? Cord prolapse is the, yes, here the umbilical cord came out of the vagina and the membrane is ruptured. Okay, membrane is ruptured, umbilical cord came out of the vagina is the cord prolapse. And in the cord presentation, what happens? In the cord presentation, yes, there will be a umbilical cord which is present in front of the presenting part. Okay, so in the occult cord prolapse, what happens? Yes, in the occult cord prolapse, the umbilical cord will be stay parallel to the or the alongside of the head. Okay, that is the what we call the occult cord prolapse. So these three are the very important. The examiner will ask the question like this. Okay, yes, he will mention in the question the cord is slips alongside of the presenting part, but not visible or not palpable per vaginally. But so here the cord is alongside of the head, means we are inserting the hand per vaginally, we can't palpate the cord. But if the cord is below the head, means if we are doing the PV per vaginal examination, that time we can feel and we can palpate the cord. In the umbilical cord prolapse, the cord will come in your hand only. Okay, that is you can easily palpate the cord, right? So in the occult prolapse, there is no chance of the palpating the cord will be there. Okay, so very important, the palpation of the cord is not possible because the cord is still not came out, or the cord is not below the head, which is just alongside of the head. Okay, that is what you call as the occult prolapse. Okay, very important. Then comes to the cord presentation. In the cord presentation, cord is lies below the presenting part but within the intact membrane. Okay, membrane have been not ruptured in the cord presentation, right? So we are doing the PV, means yes, the cord is in front of the head, means just we are doing the PV, means to our fingers the cord we can feel. Okay, so in the fingers we are feeling the cord, means yes, the pulsation we can feel. That is the very important thing. Please do remember. Okay, in the cord presentation, the cord palpable, we can palpate the cord. Okay, the cord prolapse or the true prolapse, what we can say. So in this particular situation, cord slips. Okay, cord slips past the presenting part into the cervix and the vagina, and the rupture of the membrane will be there. So the cord will be comes out of the cervix and vagina, and it will slips past the presenting cord, means it will crosses the presenting part. So it will crosses the head, it will comes out of the vagina. Okay, so it will be outside clearly visible, and which will be clearly palpable. Okay, so that is the very important. That is what you call the cord prolapse. Okay, so hope these three words are very much clear here. Okay, so you can identify and answer by the image also. Okay, hope it is clear to every one of you. Yes, here comes to the next question. What is the immediate priority management in the umbilical cord prolapse? So prolapse means the cord is came out of the vagina. Okay, so in the umbilical cord prolapse, what is the immediate priority management we need to do here? Yes, option A, start IV antibiotic. Option B, insert the Foley's catheter and empty the bladder. Option C, relieve the pressure on the umbilical cord and prevent the fetal hypoxia. And option D is the prepare for the induction of the labor. So what is the correct answer? What is the correct answer, beta? Yes, the correct answer goes to the priority management here in the case of the cord prolapse is the first you have to relieve the pressure from the umbilical cord. Why? Because umbilical cord is the main blood vessel which is having the two important arteries and one important vein. A vein is carrying the oxygenated blood to the fetus and arteries are carrying the deoxygenated blood back to the placenta. So here the umbilical cord is having the pressure means all the arteries and veins are the main branch of the blood supply is blocked. So the child is having the hypoxia, so there may be which may leads to the fetal distress. So in order to avoid that one, first priority in a cord prolapse is to remove the pressure from the cord. Okay, so that is the very important thing. Just try to keep in your mind. Okay, and here we are inserting the catheter. Here we are inserting the Foley's catheter, and we need to fill the bladder. Okay, we need to insert the NS inside the bladder so that the head of the baby can go side and we can relieve the pressure from the umbilical cord. Okay, so here in the question they have given the empty the bladder. Better we will not empty the bladder. After inserting the Foley's catheter, we will fill the bladder here. Okay, we will fill the bladder here. Very important. And IV antibiotic no need to start, and it's not having the such important management here. Okay, and prepare for induction of the labor is the not incorrect answer. So answer C goes to the correct answer. Priority management will be the relieve the pressure on the top of the cord to prevent the fetal hypoxia. Okay, so here comes to the next question. Yes, in a hospital setting, while performing for the emergency cesarean section, so what happened in the hospital setting? So in a hospital setting, while performing the emergency cesarean section, okay, delivery of the cord prolapse will be there. So while performing the cesarean section, delivery for cord prolapse, the nurse should do here. Okay, so in the hospital setting, the patient is in the hospital. Now the patient is having the emergency cesarean section. We are doing the delivery. Okay, so why? Because the mother umbilical cord is prolapsed out. Okay, so till the temporary management. Okay, so till we are doing the emergency cesarean section, until that we need to cover that particular umbilical cord. Better. So surgery takes an emergency LSCS take around at least, if the experience then a 25-year, 35-year experience obstetrician is doing the surgery means that time at least it will take 30 to 45 minutes, right? So until that the baby is getting the supply, like blood supply to get decreasing means which may causes the fetal hypoxia. In order to prevent that one, okay, so we will allow the umbilical cord veins and arteries to get dilated. Okay, so when the artery and vein will get dilated, when we will give the warm soaked saline gauze. Okay, so if we are giving the cold or the cool saline gauze means again the vasoconstriction will happen and again a low blood supply will be there. Okay, so we need to cover the exposed umbilical cord. Okay, so we need to cover the exposed umbilical cord with the warm saline soaked gauze to visible cord we need to cover. Why? Because this warm gauze, okay, which keeping the umbilical artery and vein open and which is supplying the blood. Okay, so that is the very important. Please do keep in your mind. Okay, so don't never ever try to push the cord back into the uterus, and don't encourage the mother to walk around. And encouraging the mother to walk around means again the umbilical cord will come out. Okay, so don't clamp and cut the cord immediately because it is the main source of blood supply to the fetus. Okay, so correct answer for this question goes to the option C. Okay, so this is the correct answer for this particular question. Very important. Please do keep in your mind. And so this is the very important thing just we need to keep in our mind. Okay, the management of the cord prolapse, we need to give the knee chest position. Okay, so very important, or we can say the steep Trendelenburg positions we need to give here. Okay, so and we need to fill the bladder with the normal saline. Okay, so in order to lift the pressure from the umbilical cord. Okay, and we need to cover the cord with the warm saline. Okay, not cold, but in the option you will get the a cold saline soakage also and the warm saline soakage also. Don't get confused. If you are giving the cold saline soakage, yes, it will cause the vasoconstriction and the fetal hypoxia. So don't give the cold one. Okay. So we need to cover the umbilical cord with the warm saline soakage gauze. Okay. Very very important. And don't try to hold the umbilical cord in the hand. So कैसे लगेगा देखेंगे एक बार. ओके बोल के सो हाथ में पकड़े ऐसे प्रेस कर रहे तो पेटस को ब्लड सप्लाई कम जा रहे. सो अंदर से पेटस बोल रहे अबे छोड़ दे, मेरा अम्बिलिकल कार्ड है, मेरा ब्लड सप्लाई है, तो हाथ से पिचक रहे तो उसको छोड़ दे. तो अंदर से पेटस बोलेगा एंड बाहर आने के बाद वो तुमको मारेगा. ओके सो इसलिए डोंट होल्ड द अम्बिलिकल कार्ड इन द हैंड एंड डोंट प्रेस द अम्बिलिकल कार्ड by the hand. Okay, and don't try to push the umbilical cord back into the uterus. You are trying to push means yes, again the umbilical cord compression will happen and it will decrease the blood supply to the fetus. Okay, so very very important, please keep in your mind. Okay, don't try to hold the cord and don't push the cord back into the uterus. Okay, so cord just we need to cover with the warm saline. Okay, so that is the very very important, keep in your mind. Okay, the management of the umbilical cord prolapse. Okay, so this is a examiner favorite question. So here comes to the next question. Yes, please do read the question carefully, completely, and try to give the best answer. So what is the correct depth of the chest compression in the adult? The correct depth of the chest compression in the adult, quickly we will revise this one. Okay, so option A is the about 1 inch or the 2.5 centimeter. Option B is the at least 2 inch or the 5 centimeter, but not more than 2.4 inch or the 6 centimeter. Option C is the exactly 3 inches, that is the 7.5 centimeter. Option D is the as deep as possible. Yes, what goes to the which one is the correct answer here? Yes, at least 2 inch we need to push, but not more than 2.4 inch. You are going more than 2.4 inch, the rib fracture may happen. Okay, so in order to avoid that one, okay, at least 2 inch is the minimum, or the at least 5 inch is the 5 centimeter is the minimum, but you can go till the 6 centimeter or the 2.4 inch you can compress here. Okay, that is the very very important. At least 2 inch we will do, or the we can go till the 2.4 inches or the 6 centimeter. One single best answer is the 5 centimeter or the 2 inches goes to the one single best answer. Okay, so do remember all the depth of the chest compression in the CPR. Okay, in the adults. Okay, at least 2 inch or the 5 centimeter, but not more than 2.4 centimeter or sorry 2.4 inch or the 6 centimeter. Okay, and in the children's the depth will be approximately 2 inches. Okay, this is the maximum in the children's. Okay, so don't go more than 2 inches in the children's. Okay, so that's the 5 centimeters the maximum in the children's. Okay, so about 1/3 of the anterior posterior chest wall we need to compress here. Okay, so do remember. So this is the chest. Just to give me a minute. So this is the body of the patient. Here will be the head. Okay, and here will be the our like anteroposterior part of the body. Okay, so this will be the chest, right? So this is the 1/3 of the chest, 2/3 of the chest, and the 3/3 of the chest. So here we need to push at least 1/3 of the chest. Okay, so at least we need to go for the 1/3 of the chest. Okay, about 1/3 of the anteroposterior diameter we need to push here. Okay, that is very very important, please to keep in your mind, right? So the next one is the in the infant. So depth of the compression in the infant, that is in the less than 1 year, approximately 1.5 inches. Okay, so that is the 4 centimeter or about 1/3 of the AP diameter of the chest. Okay, so please do remember this very important golden word. Okay, so these are the words which will directly come in your exam, right? Which is having the highest chance to strike in your exam. Hope it is clear to every one of you. And here will be the very very important assignment to every one of you. Yes, a Kocher's incision will be given in the which particular surgery, and the McBurney's incision will be given in which particular surgery, and in the LSCS we will give which particular incision. So this was the your today's assignment. Okay, so let me write the particular questions. Yes, the question, that's the McBurney's incision. McBurney's incision given in which particular surgery? Okay, this is the question number 1, and this is the question number 2. Okay, that is the Kocher's incision. purchase incision will be given in the which particular surgery. Okay, so these are the just your assignment to comment in the comment box. Okay, so Fatafat, do comment your answers, right? So we will meet again in the tomorrow session with the same energy and with the same and very important topics of the discussion. Okay, so still somewhat questions from the research and management along with that one, some questions from the community health I will cover for the next 2 days. Okay, so don't miss the class in the tomorrow session also. Be motivated, be disciplined, keep on practicing. Okay, so focus on your particular whatever last minute revision notes what you people have been done. Okay, so don't take extra stress. Okay, keep on revising and don't forget to attend the daily live Norcet real time exam. Okay, and we will meet again in the tomorrow session. Tab tak ke liye, Jai Hind, Jai Bharat, love you all. The link of the master nursing classes app I have given in the description box. Join now, download now, and the WhatsApp group link also I have given. So if you want for more updates on the exams and all the notification and all the job related updates, so please join our WhatsApp group also. Group link I have given in the description box. Thank you so much. We will meet again in the tomorrow session. Bye bye. Take care. Love you all.